Up to? I got a couple of doctors hanging with me. Very special guest that Jody will tell us about out of Oklahoma City. There's Dr. Steve going on here. Olympics are going on, of course. Here's the medal count. We're doing okay. Steve, I'll ask you first before I go to Jody. Watching the Olympics, Doc Steve, or not so much?
Off and on, off and on. And making sure that I get to watch Simone Biles because it's so special.
Yes. Jody, how many hours do you do? I mean, I came into the house today. You got it on. I mean, you've got it on all day, buddy, don't you?
Well, I just kind of leave it on, and then when I'm in and out, if I'm on the phone, sometimes I'll glance up at it. And, I very much have an interest in it. I love the sports. Some of those sports we participated in ourselves, and that's fun. Track and field, softball, baseball, all those things.
Yeah. Well, tell us about our special guest. Tell us about our special guest today that we have in the house. It's an honor, isn't it?
Absolutely. This is Dr. Emil, and Dr. Emil is a great, great friend. He is a cardiologist. He's an excellent cardiologist. He does all kinds of wonderful things. He spent some time here.
Yes, of course.
Angioplasty.
Yeah.
Tell us about the time you spent in Wichita.
I'm actually currently practicing in Oklahoma City with as an interventional cardiologist. But during my journey as a cardiologist and evolving into all the things that I do, I'm beholden to Dr. Galichia. And I came literally to his many special learning experiences that he would organize for cardiologists across the country. And I learned the technique of angioplasty from him. His skills are so impressive. The way he would cross the blockages, the way he would fix the coronary arteries, the pearls that you learn from him have stuck with me for most of my practicing career. As a matter of fact, I was just complimenting that every day I benefit from his expertise that he taught me. And since that time, I've never forgotten him. And I'm ever grateful to him because every day I benefit from his expertise that he imparted to me to this very day. And I'm really not exaggerating this, just an incredible, unforgettable experiences I had with him in the cath lab.
Right.
While we both were in a trance when with the human heart. That's a great time to learn.
Well, one of the wonderful things was that Emil's from Oklahoma City, so he wasn't so far away. And every once in a while, he'd call and he'd say, "Hey, can I come and spend the afternoon with you? And oh, by the way, what are you doing for dinner? Can we spend a little time together?" And we had some of the best times, both working, and then taking a little break and going out and having a bite to eat.
Yeah.
And I really cherish those
Yes, sir. I agree with you. That was some of the most fun times I had with the boss here, having a nice steak in Kansas, by the way, of all things.
Yeah. Well, and so many new things have come along because one of the things that we were lucky about on Neil was that we were kind of on the forefront of most of the new developments and coronary angiography and in heart disease, period. Not everything, of course, but in a lot of things, especially those things that involve blocked arteries in the heart and legs and elsewhere in the body. Stents, balloons, all those kinds of things, lasers. So having you here always was a stimulus for, trying those things and demonstrating those things.
Thank you.
And I really enjoyed that.
Sure.
And I think that we both learned because, when you're teaching somebody something you learn yourself, you have to know as you explore the knowledge, how to impart that knowledge to somebody else.
Sure.
So that's been a great experience.
So thank you, Dr. Galichia. That's awfully kind of you. But you have to remember that Dr. Galichia worked with the father of angioplasty, the guy who did the original work, which subsequently changed the face of practice of cardiology, Dr. Andrea Gruncic. He was the inventor. He was the forefather of the modern cardiology, and Dr. Galichia had the privilege and to learn from him while he was in Zurich. And I think he carried the same genes, and then he brought them to USA, and then he disseminated this all across the country, and I was a beneficiary of that. and that's the reason I'm here.
Well, the story with Andreas Grünzig is a great story, really, because Andreas Grünzig was actually from East Germany originally, and then he became involved in cardiology. And the way that I got involved was I was over in England. I had gone to school in England, and I had some friends that I played basketball with and went to school with who were from various parts of Europe. So after watching the Wimbledon tournament one year, I told my wife, let's just drive back through Germany and say hello to some of the old friends, some of the old teammates. And so along the way, I picked up this German newspaper, and the newspaper said, I just read it in German, and it said, "Doctor saves life with balloon," and it had a picture of Andreas Grünzig on it.
Wow, what a
And I
story.
said-
I didn't know that.
Yeah, and I said,
Oh, you
what the heck is that all about? So I read the article, and it said that a patient had a blocked artery in his heart, and this doctor took a balloon and expanded the artery, reestablished the blood flow,
Wow.
and saved the saved his life.
Yes.
And so I'm like, okay, I gotta know more about that. So when I got back to the hotel, which I think at that time we were staying in Germany, in Munich, I called Andreas Grünzig and I said, I want to come and work with you. And he just went crazy. He said, no. He said, I'm getting calls from all over the world. Everybody has read this article and everybody wonders what it's about. And it was the 8th case in the world.
Man.
So that was his 8th case. And all first cases had survived well, but he didn't want to get the word out yet until he figured out whether it was really worthwhile or not. And Steve, that was kind of the important thing about Grünzig. He was such an honest guy. You know, he wasn't going to try to sell anybody on anything. So he just forbid the patients from telling their story, and he forbid doctors from coming. So when I made that plea, I think I told you about it, and he just went, oh, no, never. I don't want anybody here till I've done 50 cases. And about 3 months later, he called and said, okay, you can come for 1 week. And so his secretary called me and he said, you're 1 week only. So I got there, I just went straight there. And after the first week, we got to know each other a little bit. I helped him with a few cases. And then he said, okay, 2 weeks, 1 more week. So then that turned into, at the end of that week, then he said, okay, as long as you want, stay. We worked together.
Amazing.
And so that was the way that my relationship developed with Andreas Grünzig. And of course, that led to just about everything. And Steve, you remember I used to be gone once in a while, a week here, a week there from our clinics in Parsons and elsewhere, you know, because I was working over in Zurich. I learned so much, and being a part of those early days, oh my gosh, every day, Andreas Grünzig and I were finding out something new right in front of our eyes.
That's amazing. You know, the entire history of cardiology, the practice, the revolution was taking place, what Dr. Galichia has mentioned. And it saved millions of people from going to unnecessary bypasses. I think billions and trillions of dollars were saved by this technique of angioplasty, which Dr. Galichia learned early on. And it's just mind-boggling just to think about it. And Dr. Galichia just puts it in such a simple form, but amazing, Dr. Galichia. Thank you for what you did.
Well, you know, Steve, what would happen too is that if you had a bypass operation, you would lose about 6 weeks of work back in those days. You couldn't go back to work if you had a job. It would be very hard. And what we found was if we did angioplasty and we got a good result, 2 days later, patient was back at work. And then, you know, it improved tremendously. And I'll tell one more story because it's a very, very important one. And that is that we wanted to do a balloon angioplasty. In other words, repair the artery with a balloon in a very simple way in a patient in the middle of a heart attack while he was having a heart attack. The patients we were working on were more stable. And of course, what we were trying to do early on was take no chances. We didn't want a death. You know, we didn't want to scar the work we were doing by getting a little bit too far ahead of ourselves. So there was a gentleman who came to visit us from northern Germany, and he said, I'm the chief of cardiology there and everywhere in that part of Germany. We'll do a heart attack there. And we did, and it was successful. And in that 1 year, Steve, we've talked about this before. In that 1 year, the death rate from a heart attack fell from about 18% from an acute heart attack. In our own hands, we were part of a study, a national study of, I think, 7 NIH different institutions. The death rate fell to less than 8%. That was the first year. And the second year, the death rate fell to 4%. So you can imagine if you had a heart attack and you came in, you had about a 1 in 5 chance of dying right there in the hospital. And in that very short period of time, we changed that around to 1 in 20. You had a 4% chance or less. And in our own studies, actually the ones that we did here in Wichita, the death rate was even less than the national average that we had. So that was an incredible time in the history of medicine, and it has helped a lot of people. Steve, what do you
Very
think?
much so. I was doing coronary artery bypass 1976
Oh, I see.
before you had all of this discovery.
Sure.
And if someone had a heart attack, we treated them very expectantly. We did not even do an emergency angiogram on them until at least a week or 2 later. And but trying to do an emergency coronary artery bypass on a fresh heart attack was it was bad news.
Sure.
And the amount of stress that it puts on the patient to undergo that much surgery, it is unbelievable. Every
Sure.
once in a while, I'll have a patient say, well, if I needed surgery, I'd want you to do it. And I said, no, I was very good at doing really big operations through really big holes.
Wow.
You don't want that now.
Yeah. Well, I think the thing that was so unusual here was that during that time when we had patients just sitting there waiting to see if they were a candidate, even for, like you said, a heart cath. What's the risk of that? Well, we weren't sure, and if we did a heart cath, there wasn't anything we could do immediately anyway before we had balloon angioplasty, because you couldn't do surgery immediately on a patient who was having a heart attack. We would wait like sometimes 4 weeks, 6 weeks before doing a bypass operation, even if we knew that's exactly what the patient needed. So all of those things came into play then when we did that very first heart attack patient in the world. And that was done on a gentleman who was actually a cardiologist working at the university there. And we'd made it through the day, and we were kind of waiting for the first heart attack to come in. And believe it or not, we got a call. The other doctor and I, the guy that was in charge of cardiology in that part of Germany, we got a call that one of the cardiologists himself was having chest pain. So we rushed in. We were having dinner. We rushed over to the hospital, and he was indeed having a heart attack. And we went in immediately and opened up his artery with a balloon only. And 10 minutes later, he went from having a blood pressure of 50 and almost dying to saying, hey, what are you guys doing anyway? How's it going? Am I okay? Hey, I feel good. And so that was kind of the beginning of it all. And then when I came back here, we did the same thing. And then it's just evolved. And then now, of course, if you have a heart attack patient now, somebody comes in with a heart attack, what do you do? What kind of
basically, Steve, I'm very impressed that you guys were doing bypass on an acute MI. that is very heroic. But these days, Dr. Galichia, we have a team in place. So every time somebody is recognized as having a heart attack in America, we are very lucky. We have a system in place. The whole system is activated. The patient is picked up from the site of the heart attack, brought into the main system. From there, the clock starts ticking. Our goal is that within 90 minutes, this is what we call as door to balloon time.
Yeah.
Our goal is to recognize where the blockage is, immediately take all the steps to open it. And we use different steps which were outlined by Dr. Galichia, and he is the one who devised it. We try to cross it with the wire. We restore the flow, recognize where the clot is. Then these days we try to go over the wire and try to suction out the clot, either using an export catheter or there are some other modalities. So take the goo out, which is stopping everything. Then we go in there, put a balloon. Once the flow is restored, then we deploy the scaffold, which is called the stent. So basically, within a short period of time, we take the patient from the site of the heart attack, put him on the table. Once he's put on the table, we find out using an angiogram where the blockage is, then try to open the blockage right away using the wire, suction the clot out, put a balloon, restore the flow, and then put the stent. Once the stent is deployed, you go from blue color to pink color.
Yeah.
All of a sudden, life seeps in. So all this is accomplished within a narrow limit of time because we call this as time is muscle. So this is what we're doing now, Dr. Galichia. We do it in a very expeditious and it's synchronized. It's like a symphony. It's like a choreography.
Yeah. And then in those early days, we didn't have the music to play the symphony.
Yeah.
So we had to figure it out as we went along, just like, okay,
Sure.
what do we do now? What do we do now? But very quickly, we learned that time was of the essence.
Sure.
The quicker we got in and opened that artery up, the better chance we had of saving that person's life in the middle of a heart attack. And Steve, that really panned out, because what we found was then in that second year, when we started doing that kind of technique for an acute heart attack patient, the death rate fell so dramatically that people would look and go, wait a minute, you guys missed something? 4%? No, we took it down from 20% to 4% of patients who died. Yeah. And then there were some patients who did this. We would have a great result, everything would look perfect, and then at 10 o'clock at night or 1 o'clock in the morning, I'd get a call that said this patient's shutting down his artery again. It happened not so frequently, but maybe on the order of 5 to 10% of the time. So then what do? You go straight back in. Again, time is of the essence. I made some quick trips to the hospital in the middle of the night, I can tell you. And then you open up the artery again and put some blood thinner in, some clot dissolving medication, and that improved your chances of keeping it open longer. But once we got stents, the scaffold that you mentioned, you put a stent in, it supported the artery itself. And that really, really changed the survival rate, and it changed the number of times that we would have to go in the middle of the night and do it all over again. Because that was a trauma. It was a trauma to get the nurses there. It was a trauma to get all the stuff reorganized, that you had to do so quickly. And it was a trauma for the cardiologist. I mean, I can remember sometimes I'd be really, really tired, and I'd stay up doing a couple of those in the middle of the night. And then the next morning, what you got to do? Go to work again, because there are more patients coming in. But somehow we survived all that. And then I think we were the second place to use a stent. And the stent really, really changed things, Steve, because like you said, you put the stent in and that keeps the artery open.
Pioneers like Dr. Galichia have really changed the landscape. We make it sound so easy, Steve, but we are beholden to people like him who, and people like you, of course, who were challenged. And you came up with a set of recommendations and set of techniques. This is amazing.
The one thing I remember, Jody, is yes, you would get the heart open, the patient would be doing well, but before we had stents, at 3 to 6 months down the road, if they started to having chest pain, you're back out to Wichita to see Jody again.
Yeah. The recurrence rate, there were two problems. One was a recurrence rate of maybe 20-some%, sometimes less, sometimes more in different centers. In other words, you fix it you get this good result with the balloon only, and then it recurs at some point in time. So now you got a blockage all over again. Same kind of blockage, usually in the same place, but now you got to fix it again. And some of those occurred really early. Like they go home and then 2 weeks, 3 weeks, 4 weeks later, they've got chest pain, and you say, oh my God, now something happened to that site, that it recurred.
Sure.
But once we had the stents, wow, that changed dramatically. Then that didn't happen very often. Now, another thing happened that we were very, very proud of, and that is that we developed a stent that was coated.
Absolutely.
So then it had a medication on it that also made it less prone to recur.
Sure.
So, now you got a medicated stent that keeps the vessel open even better. So the number of recurrences became less, and the number of times that people had to come back were much less.
Absolutely.
And also another thing, Emil, and that is that if you got a recurrence with a stent, it usually occurred later. I mean, like not in 2 months or something like that, but maybe in a year or two.
Absolutely.
And that still is the case. So we are still using that same technology. But then we also found that we could do the same thing in the kidney arteries. We could do the same thing in the legs. And we did, I think we did the second case ever and in the neck, dilating a carotid artery. Couldn't even do it in the US because nobody would approve it.
Sure.
So we worked with some people in South America, in Argentina, who were great operators that spent time here with us. Had spent, like you, they'd spent a month or a week or a couple of weeks. So they lined up these cases, and we went down there and did stents on the carotids.
Wow.
Instead of surgery, because these happen to be people who were so bad off that they couldn't withstand surgery. So the stent technology just really revolutionized the way we treat patients. And it revolutionized what happened to the patients after they were treated, how long those vessels stayed open. Pretty wonderful thing. And, the crazy thing is that we had a hard time. I remember when I came back from Zurich, Steve, it was almost impossible to get permission to do a balloon angioplasty. I was very, very lucky that here in Wichita, one of our hospitals said, yeah, we'll let you do that.
Wow.
We'll let you try that. And every case I had to clear with somebody, and make sure that it wasn't something that we just bootlegged on our own. But, it didn't take long for the world to realize, wow, this is the right thing to do. And that's how it evolved.
The politics of that, Jody, basically, if it does not come out of some famous university with the whole university team, it's really hard for the individual private practitioner who has discovered something to get it into mainstream medicine. So you did demonstrate exactly what we're talking about.
Yeah, I mean, I
Indeed.
had to show how many cases I did in Zurich. I had to have Dr. Grinzig's blessing, that, yeah, he knows what he's doing. And then they would limit, I'd have to go before some committee before I could do a case. And a couple of times we had patients who just couldn't wait that long. They didn't have time for somebody to go and run this thing through a committee. And fortunately, somebody in the government said, okay, we'll approve it, just like that. I made a phone call. I said, we don't have time to mess with this. We got to take care of this now, or this patient's going to have a heart attack. And he
Let me see if I can bring Sal Barbaro back in the show here. I hear you, Sal. I don't know if we see you right now. Can you hear us okay? How's your day, sir?
I can hear you okay. I just wanted to apologize, Dr. Galichia, that I'm supposed to be on the show, and I just had a guy drop here on the golf course and just suffered from what I believe was heat exhaustion. It's really hot down here in Texas, and so I first approached the guy. He was talking to me. He was clammy, and he was talking to me, so I didn't think he was having heat stroke, and we just had he had, but I believe was heat exhaustion. So finally got EMS here. We got lines in him, but it gets hot out here, and you could suffer real quick. You could get dehydrated. He was cramping because potassium was going crazy, and then he just finally left. So it's taken me about 35, 40 minutes to get him stable and get him out of here.
Oh, boy.
So
Well, Sal, I don't know if you were involved in this, but there was a call that I got maybe 15, 20 years ago. It was a long time ago, from the golf course at Crestview Country Club. And I know that you played there. And the head pro said a guy just had a cardiac arrest on the golf course, and there was a cardiologist playing next to him, and he resuscitated him, called 911. The guy's awake and feeling pretty good, but he's on his way to your hospital.
Yeah.
And I don't think it was you, Sal, that did that, but it could have been. You would have been the most eligible one. Great golfer and also a great cardiologist. But I will never forget that case. I think it was actually one of our radiologists who did that.
Sal, let me ask you also about this guy. I mean, golfers tend to not hydrate. I know that a lot. I mean, I forget about it. I mean, and even after, if you have a couple of beers, even on the golf course, Sal, doesn't that also increase my chances of heat exhaustion?
Yeah, I mean, I don't think he was drinking. I mean, I kind of looked in his cooler real quick and didn't see a lot of beers or empty beer cans or things like that. But he just definitely was out of it. And as far as he was laying on the ground, like I said, he was sweaty. I mean, I tried to get his pulse. It was thready. Our first blood pressure, actually, when EMS got here, they actually had a hard time getting in. And I told them, I said, just inflate the cuff, and at the point at which you lose the pulse, that's the systolic pressure, and it was about 60. And so he was barely hanging in there. So, but they eventually got a line in, and you could just see they were pushing on the bag, getting fluids in him as fast as they could. And he got a little bit combative, but his pupils were reactive. Able to shine a light on him with my phone, and so he'll be okay. It's just a classic thing out here. We don't get too many cases because they post in the golf carts here. Make sure you stay hydrated. The girls are always coming around. The guys, with waters and. But out here in Texas sun, it doesn't take much, to do that.
A story I've told before, but Emil, you haven't heard this story. There was one call I got from a golf course or from a tennis court one time, and it was when we actually owned the racket club at the time. And I got a call, and they said, well, one of your patients had a cardiac arrest while playing tennis. Mm-hmm. But the guy next to him happened to have been a cardiac surgeon. So on the court next to him, he resuscitated him, and he called 911. They came and shocked him, and they said, he's on his way to you now. And I said, gosh, is he doing okay? And they said, well, he's a pretty competitive guy. And he woke up, and the first thing that he said when he woke up was, okay, whose serve is it now?
Well,
I've told that story before, but it was and I knew the patient so well, and that was just the kind of guy he was. He was a highly competitive guy. But you think, the first thought on your mind when you awaken from the dead was, whose serve is it?
Jody, I've had the same experience, but a little more personal. My stepmother called me and said, your father's dying. So I go over to their house, which is 10 minutes away from mine, and he was watching the Seattle Seahawks play football, and he was unconscious. He still had a pulse. We got 911 to come and take him to the emergency room. I get him to the emergency room, and I said, I got to put a pacemaker in it. His pulse was still 17. And they got the C-arm there, and the C-arm broke. The imaging thing. I said, give me that temporary pacemaker that's got a balloon on the end of it. I floated that balloon into him, got it with the luck of God, got it in the right place, turned it on, got his rate up to 72, and he woke up and says, what's the score?
But just a side note, we're professionals, right? And especially me. I mean, this is what we do all the time. And but you're limited without outside the hospital, but maybe we should do a show on heat stroke and heat exhaustion, especially with the heat that we have down here, and the differences and little things that you could do to try to just buy time till the bigger help arrives. Like one of the things I did immediately was get his feet up, put his feet up, to get his feet up to get more blood rushing to his head. Cooled him down, got some things, put something under his head. We got ice. They did have ice packs. We broke some ice packs, and because you don't have IVs, but things you could check and just try to buy time till the EMS people get here, and they even had a hard time getting a line in him because, like I said, his pulse is an IV in him, and they used a 20 gauge needle, a bigger needle, to try to find the vein. And once we did that, we were set. We started getting fluids in him. His cramping started going away, and he started to calm down, and he wanted his billfold and his keys and things like that. And I actually I can't believe I said this to him. He was playing in the tournament. I said, "Well, you're probably now DQ'd." Anyway, talking about golf. So Scotty Scheffler won the Olympics today, and shot an incredible round of golf to win that gold medal. Go, Mr. Scheffler.
Yes.
Incredible.
Well, Sal, I know that family is blessed to have you on site. Thank you for doing that. Steve, thanks you for your input. Dr. Emil, great to meet you. And Jody.
Thank you, sir. It's an honor. It's a privilege. Thank you, sir.
Thank you.
Hope all of you have a great weekend.
Thank you, gentlemen. And thank you, doctor. Thank you.
All right. Bye-bye.
Great job.
Thank you.
Thanks.